Hi, I'm Anastasia. I was born in Ukraine. At 11, I moved to Germany. I studied at Charité, Europe's top hospital, and now I work in the US, leading clinical AI research tied to FDA approvals. I have an MD and almost a PhD, but titles don't really matter. What matters is that I've seen medicine at its best and at its most improvised. The deeper I went, the more I understood that the issue isn't in knowledge. It's the gap between what's actually possible and what reaches to patients. That brings me to Stanford biodesign. What does it mean? Let me show you. I was born in Ukraine, where necessity drove medicine. Ever heard about Ukrainian scrappiness? This is a torque train, because when you have nothing, you get creative. At Charité, I worked in one of the top neurosurgical departments. I became the first to pursue an MD and PhD simultaneously. My work focused on the radiobiology of radiosurgery. Unmet medical need? Check. But when you need to do a tiny step, please fill out those 50,000 forms and we'll get back to you in a year. At Yale, I led BRADS, the world's largest brain tumor segmentation challenge. That's where I learned how powerful AI can be, but also how compelling it may be to search for problems with the tools. Now at Visage, I manage FDA-approved AI tools affecting thousands of patients. I've seen how fast things move in industry and what's lost when you skip the need-finding step. One area I want to focus on after the fellowship is radiotherapy planning. Today, it's too expensive and too dependent on a handful of specialists. This limits access. Biodesign is the first place I found that teaches how to go from need all the way to the solution. But my vision goes beyond single products. Using Biodesign's global faculty training, I want to launch a Ukrainian post-war health rebuild lab, a cross-disciplinary initiative to rebuild and reimagine the world's most resilient healthcare system. And for this, I'm excited to take the first steps at Stanford Biodesign.